Welcome to our Healthcare Over 50 on YouTube. Today, we're diving deep into a silent yet significant health concern that could be looming quietly within prediabetes. Did you know that numerous subtle signals might be indicating that your blood sugar levels are creeping above the normal range? Many overlook these hints, unaware that they're teetering on the edge of developing type 2 diabetes, a condition where prediabetes escalates and becomes a full-blown disease. Here's why you should be alert. A staggering 75% of individuals with prediabetes may advance to type 2 diabetes. Despite prediabetes being a reversible condition, it remains largely underdiagnosed. Shockingly, over 88 million American adults are estimated to have prediabetes, yet 90% of them might not even know it. They might dismiss early symptoms as trivial health issues, allowing the condition to worsen over months or even years. Ignoring prediabetes can lead to severe health complications such as nerve damage, kidney disease, heart problems, stroke, and even blindness. Recognizing and addressing it early can drastically alter your health trajectory towards a longer and healthier life. In this video, we're unveiling the top 12 symptoms of prediabetes you need to watch out for, some of which might surprise you profoundly. Plus, we'll share 7 proactive steps you can take to reverse prediabetes. Stay tuned till the end to arm yourself with this life-changing knowledge. Number 1. Blurred vision. One of the most compelling yet often overlooked symptoms of prediabetes is blurred vision. This issue arises when elevated blood sugar levels cause the lens within your eyes to swell, disrupting your ability to focus clearly. Such visual impairment can signal the onset of more serious eye conditions, including retinopathy, which is a risk factor for permanent vision loss. The good news is that this blurring can be reversed. By managing your blood sugar levels and bringing them back to a healthy range, you can restore your vision to normal. This symptom frequently becomes apparent and is usually recognized in hindsight, often after prediabetes has been diagnosed. Stay vigilant for changes in your vision. It could be a crucial sign that your body is warning you about rising blood sugar levels. Number 2. Aching joints. Aching joints are a significant symptom that should not be ignored in individuals with prediabetes. Excess body weight, which is common among those with prediabetes, places additional strain on the joints, especially in the lower body, such as the hips, knees, and ankles. This increased stress elevates the risk of developing osteoarthritis, OA, a degenerative joint disease that leads to chronic pain and mobility issues. A concerning statistic from the Centers for Disease Control and Prevention, CDC, reveals that 32% of adults with prediabetes also suffer from arthritis. Research highlights a troubling trend. Nearly half of those with both prediabetes and arthritis either lead a sedentary lifestyle or are affected by obesity, compounding their risk for progressing to type 2 diabetes. Addressing joint pain and maintaining an active lifestyle are critical steps in managing prediabetes and improving overall health outcomes. Number 3. Numbness and tingling. Numbness and tingling in the feet and hands, often referred to as peripheral neuropathy, is a critical warning sign of prediabetes. This condition arises when elevated glucose levels begin to damage nerve fibers, causing deterioration even before the full onset of type 2 diabetes. Research indicates a bidirectional link between impaired glucose tolerance, IGT, a hallmark of prediabetes, and neuropathy. A significant finding is that a large number of individuals diagnosed with idiopathic neuropathy of unknown cause actually have prediabetes. Similarly, a notable percentage of those with prediabetes exhibit signs of peripheral neuropathy. These symptoms highlight the urgent need for early glucose screening and management to prevent further nerve damage and associated complications. Number 4. Frequent urination and excessive thirst. Two interconnected symptoms of prediabetes are frequent urination and excessive thirst, a pair that forms a relentless cycle. When your body accumulates excess glucose, your kidneys struggle to reabsorb all the blood sugar and return it to your bloodstream. As a result, the excess sugar is expelled through your urine, prompting more frequent trips to the bathroom. This increased urination leads to a loss of fluids, which in turn causes your body to crave more water, making you unusually thirsty. While it's true that beverages like coffee and tea can also increase urination due to their caffeine content, if you are not consuming these drinks and still experiencing these symptoms, it could be a sign of prediabetes. Number 5. Inexplicable mood swings. Maintaining healthy glucose levels is crucial not only for physical health but also for mental well-being. Prediabetes can manifest through inexplicable mood swings, as fluctuating or elevated blood sugar levels impact brain function. When there is excess sugar in the brain, it can lead to increased feelings of anxiety, irritability, anger, and a diminished ability to concentrate. Additionally, stress can exacerbate these symptoms by making it more challenging for insulin to function effectively, thus causing further rises in blood sugar levels. Fortunately, these mood-related symptoms often resolve when blood sugar levels are brought back into a normal range. Recognizing these emotional fluctuations as potential signs of prediabetes can prompt earlier intervention and management. Number 6. Slow wound healing. A telling symptom of prediabetes is the slow healing of wounds. Elevated blood sugar levels over time can cause significant damage to the lining of small blood vessels, which is critical for proper circulation. This impaired circulation means that even minor bruises and cuts may take longer than usual to heal. For individuals with prediabetes, this symptom serves as a crucial indicator that their body is struggling to manage glucose levels effectively. Number 7. Issues with digestion. Digestive problems are increasingly recognized as a common issue in people with prediabetes. Symptoms such as gas, bloating, feeling full early, nausea, heartburn, and constipation may all be more frequent among those with elevated blood sugar levels. One possible cause for these symptoms is damage to the vagus nerve, which can occur due to chemical changes in the nerves brought on by high blood sugar over time. The vagus nerve plays a critical role in regulating the speed at which your stomach empties. When it's damaged, a condition known as gastroparesis can develop, where food remains in the stomach longer than normal, leading to a variety of digestive issues. Number 8. Unexplained tiredness. Unexplained tiredness is a prevalent symptom among those with prediabetes, often linked to insulin resistance. In this condition, the body struggles to efficiently convert glucose in the blood into energy, leading to persistent feelings of fatigue. This type of exhaustion can occur even without physical exertion, making everyday activities feel more challenging. Understanding insulin resistance is key to managing this symptom, as well as preventing the progression from prediabetes to type 2 diabetes. Number 9. Skin conditions. Skin changes are significant indicators of insulin resistance and prediabetes. One common condition is acanthosis nigricans, characterized by dark, velvety patches that may appear in skin folds and creases such as the back of the neck, armpits, groin, or other areas. These changes occur as insulin levels rise and affect skin cells and melanin directly. Another noticeable symptom related to high blood sugar is the formation of skin tags. These small, soft, skin-colored growths typically appear on the eyelids, neck, armpits, and groin. Number 10. Hunger and weight gain. Persistent high blood sugar is a daunting challenge for those with prediabetes, particularly because it complicates efforts to lose weight, which is a key strategy in managing and potentially reversing this condition. When cells become insulin resistant, they struggle to absorb glucose from the blood, leading to an accumulation of sugar levels. This resistance also triggers increased hunger, prompting you to eat more, which exacerbates the problem. Moreover, the surplus glucose in your bloodstream signals the pancreas to produce more insulin. However, instead of aiding in glucose uptake effectively, the heightened insulin levels encourage the body to store the excess sugar as fat. This creates a vicious cycle of hunger, higher insulin production, and weight gain. Additional studies have linked lifestyle factors such as a preference for evening activities, late bedtimes, and insufficient sleep with greater weight gain in prediabetic individuals. Importantly, even a modest weight reduction, about 5 to 10% of total body weight, can significantly lower blood sugar levels and improve overall health outcomes. Number 11. Higher than normal blood glucose levels. The hallmark of prediabetes is having blood glucose levels that are higher than normal but not yet high enough to be classified as diabetes. Specifically, prediabetes is diagnosed when fasting blood glucose levels are between 100 to 125 mg per deciliter. Additionally, another critical measure is the hemoglobin A1C level, which for those with prediabetes, falls between 5.7% and 6.4%. This condition is also known by other terms such as impaired glucose tolerance, IGT, or impaired fasting glucose, IFG, depending on how the glucose abnormalities are identified, whether through fasting measurements or glucose tolerance tests. Number 12. Kidney damage. Kidney damage is a severe but often overlooked complication associated with prediabetes. Chronic kidney disease, CKD, which can progressively impair kidney function, is surprisingly common in individuals with prediabetes. Research from a substantial study revealed that more than 1/3 of people with prediabetes show signs of kidney disease, alarmingly at stages 3 or 4, which are typically seen in individuals with diagnosed diabetes. This finding underscores the critical need for early detection and management of prediabetes. Monitoring kidney health through regular checkups can help catch CKD early, potentially slowing its progression and mitigating further damage. It's vital for those with prediabetes to be aware of this risk and to seek regular medical evaluations to assess kidney function. Stage 5 kidney disease. Reaching stage 5 in kidney disease marks a critical threshold where individuals often require life-sustaining treatments such as dialysis or a kidney transplant. Are you noticing signs that could signal such severe health issues? Recognizing these early can be life-changing. The path to reversing prediabetes and managing type 2 diabetes involves a series of proactive steps. Here's a comprehensive 7-step strategy designed not only to facilitate weight loss but also to significantly reduce blood sugar levels, cut out added sugars, completely eliminate added sugars and artificial sweeteners from your diet to prevent spikes in blood glucose. Choose whole, unprocessed foods. Focus on consuming whole foods that are unprocessed. Incorporate essential nutrients. Make sure your diet includes vital nutrients such as dietary fiber, omega-3 fatty acids, including ALA and alpha-lipoic acid, berberine, magnesium, zinc, chromium, and vitamin D3 to support overall metabolic health. Commit to regular physical activity. A routine of regular exercise, such as a brisk 30-minute daily walk, can dramatically improve your health. Prioritize quality sleep. Good sleep is foundational to health. Establish and maintain proper sleep hygiene to enhance physical and mental well-being. Manage stress effectively. Keeping stress under control is essential for maintaining hormonal balance, including insulin regulation. Monitor your health regularly. Keep track of your health improvements to stay motivated and make informed decisions about your lifestyle and treatment options. Individuals over the age of 45, those with excess abdominal fat, those leading a sedentary lifestyle, or anyone with a family history of diabetes should consider prediabetes screening. Understanding your risk can lead to early intervention, which is key in preventing the progression to more serious health issues. Did you find this guide helpful? If so, please like, share, and subscribe to our channel. Don't forget to click the bell icon to stay updated on our latest health insights. Now, it's your turn to share. Are you experiencing symptoms of prediabetes? Have you been tested? Drop a comment below to join the conversation. Your feedback is invaluable, and we encourage you to explore our other videos for more health tips and information.